People with German Shepherds especially, listen up. Did you know that your breed is much more at risk for this issue than any other dog breed? 84% of cases of perianal fistulas are German Shepherd dogs. But all dog owners should stick around because any breed, and even mixed breed dogs, have the potential of developing these, and it's important to know about because prompt treatment is absolutely crucial. I'm Dr. M. Welcome to BMC. In this video, we are going to discuss the risk factors and treatment of perianal fistulas, so join me, you'll learn something today. First, we should cover what a perianal fistula actually is. This might also be known as anal furunculosis, and it is an incredibly serious situation that most commonly impacts German Shepherd dogs, but can impact any dog of any breed. So perianal refers to the area of the dog's body that is directly surrounding the anus or the termination of the digestive tract. A fistula is when there is an abnormal connection between different organs or there is a tunnel into the skin. In affected dogs, this is most often also associated with secondary infections. This is incredibly painful for dogs and is a serious problem for their quality of life. There is usually more than one draining tract present, although it usually starts with just one. If not treated in an appropriate and timely manner, these will progress to a point where there are irreversible changes to the skin or rectum of the dog, and it can be so incredibly painful and debilitating and not respond well to treatments at that point that it can lead to euthanasia. Let's move on to the potential causes for perianal fistulas. This is an area that we need some more research in as it's not fully clearly understood. Some people think that there is usually a component of infection or inflammation in the anal glands or the adjacent sinuses and crypts surrounding the dog's rectum. There is also a link with concurrent colitis or irritable bowel disease, so it does seem like inflammation of whatever underlying cause of kind of this perianal area is a trigger for predisposing the dog to perianal fistulas. More recent studies do indicate that this is most likely an autoimmune disease, and there is also apparently a genetic component to it because it is so frequently German Shepherd dogs that deal with this. Studies show us that 80 to 85% of the cases end up being German Shepherd dogs. Some people think that the German Shepherd dog might have more glands in their perianal area. They think that it's mostly apocrine sweat glands, so glands that produce an oily type of a sweat. There are theories that this may be one of the reasons that that particular breed is so predisposed. We don't know that for sure. Other people think that an underlying allergy component, whether it's environmental or food allergies or both, may also play a role. But again, we don't have any definitive answers. These are just the most commonly accepted theories at this time. My dog is still sleeping, sorry. We need to address the clinical signs and symptoms that you should be looking out for because the earlier this is caught and treated, the better the outcome for the dog. When this is unaddressed, it causes immense amounts of pain for these dogs, so it's very important to be on the lookout. In the very early stages of development, there tends to be very few symptoms. You might notice your dog licking at their back end a little bit more. Their tail carriage might change a little bit, and you might notice that around the rectum there could be a change in appearance, whether there's some swelling or redness, any of those sorts of symptoms. As the disease progresses, dogs will often start to strain during defecation. They might even yelp when they know they have to or are starting to or are defecating. Their tail carriage again will often change, and if you try to look under the tail, they will often protest. They may bite, they may yelp, they may run run away. It's very painful for them. You might also see them going after their back end a lot more, or acting very sensitive to even being pet around their back legs. Some dogs will hesitate to do things like sitting down. They'll stand or lay down. They may also change in their behavior. Sometimes people will notice that they might become more aggressive or more temperamental, or be a little bit more snippy than they used to be. Other dogs might become withdrawn or kind of depressed in nature. And when the fistulas are fully visible, they are characterized by a chronically oozing hole in the perianal area of the dog. They're often smelly, they're often ulcerating, they're often pretty deep tunnels of lesions. They look like a many-headed abscess or like recurring boils. A lot of these dogs will also start to lose weight, and their defecation habits will change, whether they're straining to defecate or they might have house soiling start. They might have trouble posturing to defecate. They might act irritable around defecation, just any changes around how the dog goes to defecate. This issue does occur mostly in middle-aged dogs. Some people think that intact male dogs are more at risk, and others say that we don't have enough data to say that yet. Both males and females are at risk for perianal fistulas. We can often diagnose this based on the physical presentation of the dogs, but it's so painful that we usually need to sedate them in order to do a proper rectal exam, as well as to examine the fistulas themselves. There are a number of potential other issues that this might be that we do need to consider and rule out. There could be anal gland issues. There are also severe allergy reactions that could look similarly but not be a fistula yet. We might also have a couple of different cancer types that could have a similar appearance. Sometimes there can be severe intestinal parasitism or rectal strictures that might also have a similar clinical appearance, which is why the sedated exam of the dog is very important to rule as many of those things out before we're left with presuming the diagnosis of perianal fistulas. As I'm sure you can understand, the earlier this is caught and treated, the better it is for the dogs. And the treatment of choice is immunomodulating medication. We generally will see improvement fairly quickly when we start these medications, but it can take several months and tweaking with the treatment plan in order to get perianal fistulas fully healed and under control. This is often very frustrating for the dog, the people, and the veterinarian that are trying to manage it. There are topical medications like tacrolimus that we will frequently use. This is generally an adjunct medication. It won't be enough to treat the dog on its own in most situations, but having a topical medication can be very helpful in controlling perianal fistulas. However, by far and away, cyclosporin is the go-to oral medication for perianal fistulas. Research shows us that around 95% of dogs will respond to cyclosporin, which is amazing, and a far better response rate than any of our other immunomodulating options. What's even better is that cyclosporin is generally quite well tolerated by dogs, especially if we are giving it with food and or freezing it before we give it to the dog. The most common side effects we'll see are some GI upset, so we need to watch out for those. However, we do have other oral medication options. Things like prednisone and azathioprine are often also considered. However, research shows that the response rate to those medications is not as good as it is to cyclosporin. There tend to be more side effects, and in the case of azathioprine, the side effects tend to be more serious. As dogs with perianal fistulas often have secondary infections, we also generally are required to treat those, of course. This is with the use of antibiotics. The specific antibiotic and the duration of treatment will depend from dog to dog. We also often end up putting these dogs onto a prescription hypoallergenic diet. This is because we know of that link between inflammation in the GI tract and perianal fistulas, and if we can manage that and reduce that inflammation in the GI tract, that will help for long-term control of the perianal fistulas. So blending over to a prescription hypoallergenic diet is also a key part of treatment for most dogs. We also will need to consider things like if the dog has a longer coat, we may need to clip or trim the area to help with topical treatments, with keeping it clean, with getting airflow, with reducing the amount of discharge that dries and hangs on to the perianal area. So clipping the back end might be necessary. In very severe or unresponsive cases, sometimes we will consider surgical debridement or removal of the tissue that's being impacted. This is a last ditch sort of an effort, as it doesn't tend to be successful. There tends to be a lot of recurrence. It's pretty invasive and painful, and there's a good risk of side effects due to the area that the surgery is being done in. That can include impacting a fecal continence. We also have to worry about other side effects like straining to defecate, getting some stricturing due to scar tissue after surgery, causing chronic problems with that dog anytime they try to defecate. As far as prognosis goes, many of the cases will resolve if we are persistent with treatment, and we may need to combine different medications together in order to get a specific dog's perianal fistulas to resolve. Then we tend to try to wean them down to the lowest effective dose of the immunomodulating medications that will keep them controlled. Most dogs do require some sort of longer term treatment plan in order to stay in remission. Some dogs will have flare-ups of their fistulas despite us doing our best to keep them managed. Whether the perianal fistulas do fully resolve or need long-term management, it doesn't matter. These dogs must not be bred, not ever. There may be up to around 20% of cases that end up not being all that responsive to treatment. Sometimes we will get them to partially or mostly resolve their fistulas. Sometimes they don't respond at all. In those situations, these dogs do end up being euthanized because it is an incredibly painful issue for them to be dealing with. This is why a timely diagnosis and appropriate, pretty aggressive treatment is absolutely crucial. If the treatment hasn't been started early enough, this will increase the risk of the dog developing strictures and scar tissue and permanent changes around their anus, and this can result in excruciating pain for that dog. This is something that we're wanting to avoid at all costs. Of course, there are situations where the dog is properly treated, it's treated promptly, and sometimes they just don't respond anyway. Those are terribly sad cases, but to give your dog the best chances possible, prompt treatment is the best thing that you can do. Thank you so very much for taking your dog's health seriously and joining me today on BMC. I do put out a video most Fridays, and if you have a topic you would like me to cover in the future, please comment it down below. I love to hear from you, and I hope you have a wonderful week. We will see you in the next one. Bye.